Thank you.
All right. Hi, my name is Rosanna. This is Hazel. I'm completing my teaching plan for health promotion and nursing. The purpose of this video is to go over the teaching plan that I submitted in week 5 in regard to health management for hypertension and recovery from hip replacement related to osteoarthritis. So during this video, we will be going over the goals that we set up, the 3 short-term and 1 long-term goal that we set up as far as managing hypertension and hip replacement. Miss Hazel had her hip replacement done how many weeks ago?
I had it done on June 19th this year.
How many weeks ago?
I don't know.
A couple weeks ago. But I was there from the beginning. So we've been following this process through the beginning. So the care plan that I submitted in week 5, we went through a couple questions in regard to health and in regard to medication management, as far as things as diet and things like that. So there are a couple goals that we want to accomplish during this session. One goal, which she's already checked off, is able to walk 10 minutes daily using a walker. Also, she goes to physical therapy. She had physical therapy at the house, and she also goes out to prescribe physical therapy. How many days a week?
3 days a week.
3 days a week. And we want to increase walking time to 15 minutes per day, splitting that into 15 minutes, 2 15-minute sessions. And then our long-term goal is to have total independence, being able to perform all ADLs by herself and walk without a walker. The environment which we are doing the care plan is, I would call it a home visit, because we're at her home. We're in her living room and having our conversation. During this session, I will give a couple pamphlets over to the patient. We will talk about her medications that she has and ways to take those medications. We will go over some do's and don'ts that she should follow post hip surgery. And we'll just go from there. So as we did our questionnaire, so first we'll start with medication management as far as hypertension. Medications that she's currently taking is lisinopril and carvedilol, 2.5 milligrams. Can you tell me how long you've been on those medications?
Yes.
How long?
For 2 months.
All right. So when you take your medications, do you check your blood pressure?
No.
All right. So when you sat with your doctor, did he tell you that you perhaps need to check your blood pressure before?
No, he did not.
All right. So one of the...
Now, I was checking my blood pressure, when I first got to the hospital, to make sure it was not going too high or different things like that. And then it was going too high, so they added a second medication. But my blood pressure is in range now.
And so
But no, the doctor did not tell me to check my blood pressure.
And what would you consider as in range blood pressure?
For me?
Yes.
I look at it's 148 over 72.
All right. So according to the American Heart Association, I'm going to give you a little pamphlet. Normal blood pressure is less than 120 over 80.
But then they're in trouble.
All right. So
that don't even make no sense.
So one of the things that we want to keep in mind when checking our blood pressure, of course, you do have elevated blood pressure, which means that you have hypertension. So 140 over 80 is elevated. Your bottom number is pretty good, but that top number is what they need to get brought down. Also, you're on carvedilol, which is a beta blocker, which means that you should check your pulse before taking the medication. According to the American Heart Association, normal pulse is between 60 and 100. So if your pulse is less than 60, you should not take your carvedilol.
Okay.
Okay? All right, so since we've gone over the blood pressure, the other thing that I really want to focus on mainly is care after the hip replacement. We're going to kind of go back to when you first had the hip replacement because we have been post-op almost 2 months.
Yes.
So in the beginning,
2 months.
In the beginning, there are certain positions that you weren't able to do. You weren't able to cross your legs.
Right.
You had to not
lay on my side.
Lay on your side.
Right.
Bend or twist.
Right.
Or lift.
Right.
So BLT, none of that.
Right.
And then you had to be mindful when using the walker to basically put most of your weight on the walker and not so much weight on your hip when walking.
Right.
And then you, during when you're in pain, to be mindful of your blood pressure. To make sure that there are a couple things that can happen when you're in pain that it will cause your blood pressure to go up. So be mindful of taking. You want to also check your blood pressure when you're in pain. Also make sure that you're taking your medications as prescribed. And as you're gradually increasing activity, to make sure that you, one, medicate yourself beforehand to ensure that your pain level will not be a 10 before you start walking. All right. What are some signs and signs that you need to have to rest? Would include like fatigue, increased pain, lightheadedness, some dizziness. What other signs would let you know that you need to rest instead of continuing to walk more?
When I'm tired.
When you're tired. So fatigue.
Yeah.
All right. Also, we want to make sure that we're staying hydrated, that we're eating before we start walking.
Yes.
All right. So, are you attending all of your physical therapy?
No. I miss some days.
But when you're missing days, are you performing exercises at home?
Yes, they give me like homework to do. So I do these exercises at home. I make sure that, because if I don't do them, then the hip gets stiff and it causes discomfort. Mm-hmm. So I know to stretch, and then to do those exercises, and it alleviates it. Right. And I'm able to rest.
All right. So I do have some questions for you. So what are some movements that you should avoid while your hip is healing?
Well, according to what I was told in the beginning, I am not supposed to cross my legs. Mm-hmm. I am not supposed to bend and twist, and I'm definitely not supposed to lay on that side.
And can you describe how and when you will use your walker or cane at home?
When I get ready to walk.
That is pretty much it. You want to be mindful that there aren't any wires in the way, or any rugs that you can slip on. So you want to be mindful of those things. What is your plan for gradually increasing your activity while keeping your blood pressure stable?
Well, when I go to the physical therapist, as they add new exercises to my regimen, I then practice those I practice them here at my home.
And make sure you do what?
Get my medication.
As
prescribed.
Yes, ma'am. Okay, and how will you recognize signs that you're doing too much or you need to rest?
Because then I have pain.
Right. And
I become very fatigued and my leg gets very heavy.
All right. Do you feel confident about doing your physical therapy exercises on your own?
Yes.
All right. And do you have any concerns in
Nope.
regard to that?
Nope, because I do it the way I do it in physical therapy. It's the same way I do it at home. I don't try to overdo it because then I could injure myself, and that's not what I want to do.
And since we are post-op, 2 months, although I submitted my SMART goals week 5, these things we've already implemented. As you can see, Miss Hazel is my mother and I am the nurse of the family, and so we all know how that goes. So week 8 of my SMART goal was for her to walk 8-10 minutes each day using her assistive devices, and that was done daily, walking up and down the street. She would keep her watch on her and kindly and keep tabs of how many times that she did walk and the length of time that she walked.
Yes.
So it was measurable and measured. We had physical therapy come to the house, so it was attainable, and it was also tracked with her physical therapist. She did achieve the goal by week 8 and consistently walking. And then our goal for week 9, which was our short-term goal, was to perform prescribed physical therapy exercises at home 5 days a week. And initially we did have physical therapy coming to the house. So now she does go out to physical therapy 3 days a week and then perform some of the exercises at the home. It's measurable because it is being tracked via a checklist and also what's done at physical therapy. And it is attainable because she can do both exercises here at home and she is completing the exercises at physical therapy. And it is also a realistic goal to have those therapy sessions. So week 10, we want to increase to walking 15 minutes, and we are there. She's walking not only at home, she's returned to work, so she does walk in her office too. So we've gradually increased from the 10 minutes to 15, and it is aligned with the healing trajectory. So those are both realistic and attainable in time. Now our long-term goal, which we are still currently working on, is regaining total independence from walker. She is able to walk 15 plus minutes all by herself but she does still require a walker. She should be using, she does require a cane. She should be using her walker, is she? No, she's not, but hey, those are moms and patients. She is performing most of her ADLs by herself as far as getting dressed and bathing with a shower chair.
I stand up and take a shower.
Ooh, she should be using the shower chair.
I was using the shower chair. I can stand up now.
It is measurable because we will be able to see if she's able to completely walk without the walker. So we're still working on that. It is consistent with the short-term goals as far as leading to independence. It is attainable as long as we keep track with those short-term goals, and it is realistic. But is it appropriate for 3 weeks post-op? No, it is not. It's more appropriate for where we are now, and we are now 8 weeks post-op, which is 2 months. And hopefully before we hit the end of week 11, well, a total week, that she will be able to obtain all these goals. Do you have any questions for me?
No, I don't.
All right, and thank you so much. Bye-bye.
You're welcome.